When it comes to suicide prevention, there is a stark research imbalance between low and middle-income countries and high-income countries that calls into question the global validity of our measures, models, and frameworks. Together, Professor Ellen Townsend and Dr. Penny Siebert travelled the globe and worked with a team of 20 research partners, 11 NGOs, and 80 stakeholders from 8 countries across 4 continents to develop a proposal for a global suicide prevention research hub aimed at redressing that imbalance.
How can we work together as a community? And when I say community, I mean a community of countries and a community of people. How are we going to come together, a community of researchers? How are we going to come together to produce, not a movement, but the evidence to be able to change legislation, to inform policy, to support communities?
A real benefit from this hub will be bringing together people from psychology, with people from law, with people from anthropology to really get some new paradigms, new models and new understanding of suicidal behaviour.
Because it's not about just getting people together, it's about making sure they stay together and they're productive and they feel safe and there's trust.
Really need this in our field. We're not able to predict suicidal behaviour any better than chance. And I think one of the main reasons for that is that we have not achieved real interdisciplinary working.
Developing the proposal for us is a real insight of how participatory research and a participatory approach would work. It was a real sort of beginning of the journey, which was exciting at one point, but actually fully rewarding, and we could see how this could work in a bigger scale.
We want to really understand the cultural context of suicide and, using that information, build interventions which will reduce emotional distress and suicidal behaviour.
We've really started to get already a discussion and a debate going in certain countries, and a welcoming of that this is something that people are seeing as something that needs to be tackled, but also that we're not coming at it and saying, here, this is stuff that we've done, we need you to implement it, but saying, can you tell us what we need to do? Can we work together as a group? Because that will have a bigger impact and it will be sustainable.
And what we're doing here is bringing together a global partnership of experts who are passionate about suicide prevention.
This is for life. This is about creating a research hub that's going to carry on, that's going to grow and build and become a real resource for the world, I think, and for communities. So that's our ambition, and that's really how we see it.